Hey guys, it's Dr. Ellie here with her Pod I Heal Kids. And today we are actually talking about why kids aren't thriving and how nutrition fits into real life pediatrics and what whole child care actually even looks like. And I am very excited because I'm about to introduce Brandi Moziak, who is our newest PA at Middle Path Integrative Pediatrics. I am so excited. I even put on mascara today. I washed my hair. Yes, I know. I'm like so ready for it. And in this episode, we're going to just get to know her and talk about what led her to pediatrics, why childhood nutrition matters so much and why it's special to her, and what she hopes to bring to families and, how they're going to feel when they meet her, which is going to be, obviously awesome because she's kind and warm and generous and all those things. So welcome, Brandi. I am super stoked to have you. Thank you for joining me today.
Hi, thanks for having me. I'm really excited to be here. And of course, thanks for all the sweet words. That's super nice of you. And I'm so excited to join Middle Path and meet all the families there and all the community in Asheville and see the kiddos and take care of them.
Yeah, I think, okay, Sherry, I just want you to share. First of all, I could not be happier that you're joining. Like, I kind of knew of you. I kind of thought of you. I feel like I slightly manifested it. I don't know if that's really true, but kind of maybe a little bit.
I think it did feel kind of like a little bit of a divine intervention in a way. Like we had some connections, to different people that we knew. And I had been kind of watching your practice since you started in Asheville, from afar, and it all worked out. My husband was saying that this morning, like, how cool is it that you ended up there? It just seems like the perfect fit. I'm so excited.
Fascinating. Yeah, really, yeah, just knowing all the different people. Yeah, that's so weird.
It is weird.
Brandi, I feel like people want to know your story. Can you
Sure.
share a little bit about your path, becoming a physician assistant, what inspired you to be at Middle Path, all of that?
Yeah. So I started probably 15 years ago. My husband and I, we weren't married yet, but we were both really into nutrition and decided you know what, we think that the standard diet and everything that's, we see our families doing maybe at that time and our friends, is that what we wanted? And was that making us feel good? So we decided, let's start investigating. And we were radiation therapists at the time. So we weren't physician assistants yet.
Oh, that's
But
crazy. Maybe I knew that, but I don't know if I did. You were a radiation therapist? That's wild.
So we're working with cancer patients every day. I think too, when you're kind of in that field where you're working with cancer patients all the time, you're thinking about, oh, how can I prevent this from happening, right? Sometimes, of course, there's things that are not preventable, genetic things or whatever. But I think in the back of our minds, we're always like, oh my, I just want to prevent this in any way possible. So nutrition was duh, that's it. We got to figure out how to hone in our nutrition and eat the right way. So we started reading books. My husband joined Integrative Institute of Integrative Nutrition in New York City, and we did it together because we were poor and we couldn't afford for both of us to do it. But we shared the content because we were doing it kind of for our own benefit in a way, and just to learn all the information. But that was really cool, and we learned a lot. We got to go to the Cleveland Clinic and meet with some of the doctors there and learn about how to reverse heart disease through nutrition. So once we finished all that and we had made some big lifestyle changes on our own, we were feeling good, more energetic. We're okay, now how are we going to help people with what we know now? Because being radiation therapists, we got to see patients but we were doing their treatments. We weren't helping, with their diet.
Yeah. You were well, how do I how do I bring this new knowledge into patient care? And
right.
I just want to put a fine point on this because I think this is something that comes up a lot for me, especially when I'm doing a lot of functional medicine, is that myself included, I've been guilty of this too. It's I took my X, Y, and Z supplements today. No need to eat well, sleep well, exercise or meditate. I'll be fine. And then 7 days later, you're crashing with massive adrenal fatigue. And you're well, what is wrong? And it's well, the underpinning to all of that is these fundamental things. And so the supplements are by definition, supplemental, and they're not supposed to be permanental. So I
Yes.
don't know if that's a word, but like permanent,
Yes, but
unless,
it's a good
like
bit.
a few
Yeah.
maintenance ones and things like that.
Sure.
But generally, like we're using them to um, boost a system that's kind of crashed, and
Right.
hopefully get people off that. So it's so important. But you were saying, I totally interrupted you there.
Oh, no, that's fine. Yeah, that's a good thought there for sure. But I think, we were like, how are we going to use this knowledge? And so we decided to apply for PA school. And so we became physician assistants. And I learned pretty quickly in school, even that there wasn't education on whole person care. But I was still hopeful. And I loved my pediatric rotation, so I decided to join pediatrics because I thought, okay, that's like the foundation, right, of health. Like I
Yeah.
can start from the fresh start from when they're babies and like maybe implement some like really good habits at a young age. But the traditional model, as you know, like didn't allow us a lot of time to like sit with our
Yeah.
patients and
Yeah.
talk with them about these things. It was more like diagnose, treat, move on.
Yes.
Um,
We've all been, well, not all of us,
yeah.
but most of us who've moved into like the holistic realm have just seen kind of like the shortcomings of this type of like volume-based,
Yes.
insurance-based practice. And it just is like, it's just not good for doctors who are working in that system, for our
Nope.
PAs that are working in this. It's like really anyone, as far as I'm concerned, except for maybe
Yes.
the insurance companies.
Yes.
But yeah, it doesn't
Yep.
give you any time to actually go into root
No.
causes.
Yeah, it's really unfortunate. It's yeah, it's a
Yeah.
recipe for burnout, I guess, from the provider standpoint and maybe the patients too. They just get exhausted like telling their story and not figuring it
Yeah.
out, maybe like what's going on. Um, so I worked in traditional pediatrics for 10 years, tried to weave in like some holistic care where I could. But ultimately, the insurance, that volume-based system just kind of failed me. And so I found you or you found
Yay!
me or whatever way it worked.
Yes.
Um, and I was like, "Oh my gosh, this is just like an answer to a prayer. This is gonna be just what we need," and I'm so excited. And here I am.
Oh, I'm so excited too.
Yeah.
I know that you're known in the community for being just like super warm, generous, wholehearted, and kind-hearted. Do you wanna just tell people kind of a little bit more about like your approach in general, about how you approach patients, and then also just like what does whole child care kind of mean to you in a visit? Like what can people expect when they come and see you?
So I think when you come in for a visit with me, I want to treat you like you're my family or a close friend who I really care about. So I think at starting visits, I just like to get to know families and kind of know who they are, where they come from, what their traditions are, what kind of food they like to cook, what they like to do for hobbies. I think that's just so important when like kind of tailoring care for that family and like
Yeah.
realistic goals for them. If I know like who you are and what you like, then I can help you better. So I think that's like
Yeah.
kind of where I start.
100% because it's kind of like, okay, I may love chia pudding, and if I'm
Right.
like, "Oh, you know what you should
Yeah.
do is chia pudding," and you're like,
Yeah.
"Chia makes me gag," then that's
Right.
not, like, helpful advice, you know what I
Yes.
mean? So it's
Yeah,
like,
like we're a family of very picky eaters. We like bland food or whatever, then I'm not going to recommend, that you start cooking like ethnic foods together with lots of different spices and herbs and things.
like a bowl
So
of
I,
kimchi for your toddler, like
right,
spicy
yeah, like
kimchi. Yeah.
sure, like some kids maybe, like my younger daughter like loves kombucha. So I let her have like a small glass every once in a while, but my older daughter's like, oh, mom, so gross. So, I mean, it's, everyone's so different. So I think that that's part of whole person care, right? Like everyone is very unique. And so I take a very individualized approach to everyone to make sure that I understand who your family is as a whole and then who your child is as well. And then just kind of talking to you about what areas of concern you might have for your kiddo, what areas that they're like thriving in already and doing great in. And then like,
Yeah.
we're gonna like celebrate those areas together. Um, but yeah,
Yeah. I love that you're like combining mind, body, and spirit because I do think spiritual connection is something so important. That doesn't
oh yeah,
necessarily mean religion, just for
right,
those people out there who aren't religious. That's not what I
Yeah,
necessarily mean, although it can be. But
sure.
I think that if we lose a sense of awe or we lose a sense of connection to nature or whatever it may be
Mhm.
that is giving us um, some kind of like, connection to nature or reason for living or being here or some kind of just overall spark, I guess.
Yeah,
I think that that can sometimes really affect people's health,
right.
because you can
Yeah,
sort of like go down this nihilistic path where you're like, well, nothing, why are we here? Like, what are we doing?
yeah.
And it's just so important to have that. And I love that you're bringing that to kids.
Yes, yeah, yeah, for sure, I agree with that 100%.
Yeah. I wanted to dive in. I know childhood nutrition is like super high on your list of things that are important to you.
Yeah,
And we talked about kind of like what sparked the passion, but I wonder if we could talk about like why is it so important today? Because I think it's something that we kind of like are like, oh yeah, like eat healthy, eat like your veggies,
yeah,
whatever.
yeah,
And
yeah,
it's like simple, but what do you see happening in health right now that this is like
right.
kind of in the forefront of your mind?
Yeah, for sure. I think one of the biggest things is, I mean, becoming a parent myself, when I had young kids, I was like, oh, I always cared about nutrition before then, but once I had them and I was like, oh my gosh, like I think my way of practicing really changed, but also like my focus on like childhood nutrition really changed because I saw like the direct impact of my own children, when they ate the right foods and everything. But I think in today's health, like overall, like the big picture of our community of children, there are so many barriers. So I want to help families with those, like all the packaged foods that are just like marketed to children,
Oh yeah.
even the healthy ones, they still have a lot of ingredients that are not wonderful in them. The school lunches can sometimes, I mean, even at some of
The
the
school lunches, do
schools,
not get me
oh my
started. Oh my
gosh, like, it's
gosh.
so some of them, they try really hard, and I know that some families, like, really need those because that there may be, like, food
Food
insecurity,
insecurity, yeah.
right, but when we have a choice and we might be able to, like, we could work with financial instability and stuff to still make, smart choices for our kiddos with their food, but my children be like, "Mom, it's Chick-fil-A day at school today," And we have to talk about, like, how do you feel after you eat that? Because
Yeah,
we practice like a moderation in our family. So, they can try some things that may not be the best for them, but
yeah.
I want them to like then sit and reflect and like, how did your tummy feel?
Yes,
Or
mindful
like,
eating, yes, I love
yeah, where
that.
like you came home and you just slumped down on the couch instead of going outside and jumping on the trampoline because you ate food that like didn't energize you. Um,
Yeah,
so talking to families about that too, like how do your children act after they eat certain foods, is really important, and how do they sleep after they eat certain foods. Um,
uh-huh.
but I think, yeah, some of those big barriers with like school lunches, the packaged foods, and just like the quality of our food in general, right? Like there's not the nutrients in the food that there once was. These farming practices have changed over the years and the way things are
Yeah.
manufactured and processed now. So,
Yeah, I think this is something that we can really help families with more is, and I know that you're so good at this, is like how to avoid grabbing the granola bar that has
right,
15 grams of sugar, which is way over the limit of what kids are supposed to be getting a day.
right,
So they're supposed to be
right.
getting like 4 to 6 teaspoons a day. So
Yeah.
pretty
And it's like,
low
oh my gosh.
amounts.
Yeah.
Yes. Yeah. And then you like are like, well, how much is in this one snack? And then you're like in a hurry. You're trying to live your
Yeah.
life. Like,
Yeah.
you're trying to like
Yeah.
not be crazy also.
Yeah.
And it's like, I love that you also are like kind of I think what you're saying, and correct me if I'm wrong, is kind of like that 80-20 rule. Is like we
Yes.
don't want to
100%.
like
Yep.
create like yeah, we don't want to create like weirdness around food to where we're like having orthorexia, which is
Right.
where we're like fixated on clean eating to the point that it's becoming disordered. So we're like
Hmm.
stressed and anxious about it and avoiding foods in a negative like in a
Yes.
way that's like maybe is leading to then like anorexia or like other eating
Sure.
disorders. So I think it is important to acknowledge that, you know, 80, 85%, on target,
Yes.
15% fun because people have
Right.
birthdays and,
Of
sometimes you want a
course.
birthday cake and
Yeah.
sometimes you want to participate at Christmas. So it's like,
Yeah. And like, yeah, part of our health, right, is kind of like part of it is social health, right? Like in our and our kids' enjoyment and happiness in life. And sometimes, like, especially in our culture, like food is sometimes a social activity and
Yes.
it's fun. And so that's important too. And so I think, we let our kiddos like have snacks and we eat dessert almost every night in this house, but it's
Yeah.
like we try to make it a good option.
Yeah. Yeah. Like a
But
little something versus,
yeah, like, they have
yeah.
dark chocolate chips and, different things.
Yeah,
But
like a little taste of something without it
yeah,
getting. It's so
yeah.
funny too because people are always like, "Okay, like, what are you most scared of?" And other than planes, which if anyone knows me, I really hate to fly. Thank you, Delta
Okay.
Airlines, by
Oh
the way.
gosh, yeah.
Delta Airlines, those flight attendants, they have given me ice packs. They have
Oh,
talked me off a ledge. They have been like, "You're gonna make it." So anyway, apart from flying, which is like,
yes.
oh, anyway,
Oh,
what am I most scared of? Heart
yeah.
disease.
Yes.
Yes, because, we
Yep.
all have, like, these different fears, like sharks or lightning or,
Mhm.
whatever it may be, falling off a
Mhm.
bridge or, whatever. But the truth is, like, adults, what are we mostly I mean, I don't know if I know the full list, and you may know Brandy better than
I
I,
don't
but,
know.
like, heart disease is pretty darn up there, you
Oh yeah.
know?
Yeah.
I mean,
Yeah,
maybe for
especially for
younger.
women. Especially for women though, like it's a silent kind of disease for us.
Yes, because it's like we're very fixated, I think, on breast cancer, you know?
Yes. Yep. Yep,
And
for
yet
sure.
I don't know the statistics, but I think heart disease is higher, so,
Yeah.
Okay, I wanna just enough said about that. I wanna just talk about, like, maybe some specific strategies because I think this is something that's kind of important. I know you bring a lot to
Sure.
the table with this because you have young children. I don't personally have
Sure.
children, so I make a lot of
Sure.
recommendations in the hopes that they're helpful, but I'm not living the
Yeah.
day to day,
Sure.
unless you count my 3 dogs, which are crazy.
Yeah, those are
But
like children. Yes.
I mean, they do take a lot of, like, time and
Yeah.
grooming and, like, vet
Yeah.
appointments, but,
Yeah.
maybe not in the same realm. So,
Sure.
what are, like, some, like, common we talked about school lunch and we talked
Mhm.
about, packaged foods and things like that, that are common nutrition challenges.
Yes.
So, like, do you have, like, maybe top 3 quick tips or, strategies or
Mhm.
just kinda little things that you wanna tell people, like, "Hey, try this," because I think some people might wanna know that.
Yeah. So I think I always start like let's start with infancy, right? So I think like nutrition starts in infancy. So talking about like breastfeeding and how I breastfed both my kiddos for a really long time. So I love talking to families about the amazing benefits of breastfeeding and how we can help you succeed. If you're struggling, like don't give up, like we can help you. But also like there's some great formulas out there now too, and we can supplement and stuff if needed. So focusing and like making nutrition important at a young age. So I start
Yes.
there. And then other tips, like as they get bigger, I think, always like offering a variety of foods on the plate. And I don't like to be like, you have to eat something on this plate, but just offering a variety and modeling as a parent. So I find a lot of
Mhm.
times that parents will be like, well, they just won't eat any vegetables. So I'll ask the parents, okay, well, can you tell me kind of what you eat for vegetables in a day?
Yeah.
They're like, I don't really like them."
Yep.
And I'm like, "Well, okay." So sometimes we have to do things that we don't like in order to like help our families or to be healthier ourselves. So modeling that behavior is so important for our kids. So just them seeing you eat healthy or eat foods that are going to nourish your body can be so helpful. So when my kids see me like, eating my broccoli and, whatever, having quinoa at dinner, like they're more apt to try it and eat it. So like
Yeah.
an exposure therapy. I mean, my husband went as far one time as he put a stalk of broccoli as like a bouquet, like a flower bouquet on the table
Oh my gosh. That
for
is
like for
awesome.
exposure so that they just like kept seeing it and was like and
Yeah.
they'd be interested and like want to eat it. Also like a quick like tip, kids love snacks. So
Yes.
calling things that are healthy snacks can be really helpful. So like I make like a charcuterie of vegetables and fruit and like, good healthy seedy crackers and things on a plate. And then they'll eat them. They'll just like chow down on them because they're snacks. Right.
Yes.
And so that's super helpful. And then having them cook with you. So
Oh, I
just
love
preparing
this.
a meal. Yeah.
Love this tip.
So
Yes.
we cook together a lot. Like my daughter just helped me make, we had like tacos, like beef tacos the other night, and she put all the seasoning in, so she knew exactly what was in there. She put the bone broth in and she mixed it. So
Yeah,
when
yeah.
my mom talked to her later, she could tell her all the ingredients that were in the taco. So it didn't come from a package either. Like, we made it together and then she
Oh.
ate it, and she does not like meat, but she ate it because she prepared it.
Oh,
Um,
I
so I
love
think
this
that's like a
story.
huge, huge tip. But
Yeah, if you can get
those are my
kids
big ones.
involved, and kudos to you for cooking, because I think
Thanks.
sometimes it can be a little scary too. Like if you
Yeah.
didn't grow up in a family where you cooked a lot, or
Yep.
like you weren't exposed to cooking, like just give it a try. Like even if it's
Yeah.
something simple, like making's like, like I always go to chia pudding because I love chia pudding,
Yeah.
but it is
Yes.
simple.
Yeah.
It's
Yeah.
just
It
almond
is.
milk or
Yes.
whatever and chia,
Right.
and then you just
Yeah.
kind of add on from there. And I do think home cooking is something that I think is, if you can, at
Yes.
least a couple times a week,
Right.
try to make some kind of meal together and sit, because there's just
Yes.
so many
Sit
health
down.
benefits to that. Yeah.
Yeah. Yeah. We try really hard. Sit at the table. I mean, you just like learn so much, and then food becomes again like a social event, right? So it's like, oh, you're sharing about your day and all the things. So
Yeah. Well, I feel like this is like a moment where I've been grilling you. I'm curious, do you have questions for me? Do you wanna ask me anything so we can get to know each other better?
oh, yeah, let me think. I think we talked about this earlier a little, but I want to know something that you do for your own health and well-being, that you don't love doing, but you do it anyways because you know it's like so good for you.
Yeah, we chatted about, yeah, this is 100% meditation. So if you know me, in general, I mean, we all have our days where we have less energy, but in general, I have like quite a bit of energy. I like to kind of move. I like to walk my dogs. I like to get to yoga, like different things. But
Yeah.
meditation, like sitting still, turning everything off, and like I have to do like at this point in my life, I do the guided meditations because
Yeah.
just silence, like yeah, can't quite get there.
Yes.
But 10 minutes a day, I sit with my Calm app on and I listen. And I gotta say, it really is grounding. It really
Yeah.
does help with compassion. It really does help with anxiety. It helps
Hmm.
with boundary setting. There's just so many
Yeah.
benefits to it. And I just want to point out, like, a lot of people kind of think that meditation means like now you're becoming Buddhist or something. It
Right.
really doesn't have to. It's just another relaxation technique in your
Yeah.
toolbox.
Yes.
What about you?
You've convinced me to do it. I'm not good at it either.
You're like,
I think
shoot.
Yes. I think, especially probably in the last, like, I don't know, year or so now that, like, my kids are sleeping through the night or whatever, and I'm not waking up all the time. I prior to having kids, I was a night owl. Like,
Yeah.
I like to be awake in the night. I like to read, and I like it when the house is quiet and no one else is awake and I can read my book or
Yeah.
whatever. And so, like, knowing, like, "No, Brandy, you should go to sleep." Like, shut it off, close your book, whatever, go to sleep. So,
Yeah.
like, sometimes, I'll crawl into bed and I'll wanna, like, read another, 20 pages or whatever, and I'm like, "Okay, just shut it. Go to sleep. Close your eyes."
Yeah. Yeah.
'Cause that sleep I'll feel much better the next day if I just actually get the sleep I need. Um, but the night owl makes me wanna stay up.
Yeah. No, I totally get that. My husband's the morning person here, and
Mhm.
I also like to be up. And I love that you're bringing up sleep because it's so much more important than people think, because it's
Yes.
related to blood sugar, it's related to mood,
Right.
it's related to our ability to replenish serotonin, related to
Yeah.
anxiety. Like there's so many aspects of health, and sometimes
Yes.
we're more, especially like, I don't know, like sleep, it's not that
Yeah.
important, like, maybe I don't need to get that,
Yeah.
I just need 6 hours, and I'm like, "Do
Right.
you? I don't
Yeah.
know.
I'm a six-hour person.
I don't know." Well,
Yeah.
I know you have to boogie, but I wanted to ask you one final question, if that's okay with
Sure.
you.
Yeah.
What are you most excited about to bring to our community, to bring to Middle Path,
Yes.
all of that good stuff?
So I think the thing I'm most excited about at becoming a part of the team at Middle Path is actually having I mean, I got to know my families that I practiced with before, but really getting to know them now and to sit and have like all this precious time with people that I didn't have before. So I think what I'm most excited is I think time is one of our most like valuable assets in life. And so I'm excited to give you my time and to take some of their time to learn about them.
Yeah. I mean,
Yeah.
if people don't know already, at Middle Path, we have 45-minute appointments. Your first appointment's an hour,
Awesome.
but other than that, it's 45 minutes. And it's just with you and your doctor or physician assistant. Like, there's no, like, you're not sitting in the waiting room and
Yeah.
like filling out
Yeah.
paperwork and being like shepherded through like to the scale. And then, like,
Yes.
5 minutes with your doctor. And you're like,
Right.
okay, what even happened? I don't know. Did I even like ask what was wrong? Or I don't know.
Yeah.
Or did they even ask me what was wrong? But
Mm.
I think that has been one of the absolute blessings of starting this practice. And it's been a journey. But getting to know my community, getting to know all the patients, it's just really wonderful because everyone lives like such different and interesting lives. And
Yeah.
they're such a blessing, and I really do have the best patients. I mean, I
I'm so
truly think
excited.
that.
Yeah.
I really
Yeah.
think I have the best patients. And on that, if you want to become a patient, go to my
Yeah.
website, middlepathintegrativepediatrics.com. Right there at the top, you can click on book a meet and greet. We'll be opening up meet and greets with Brandi mid-January, I believe. Might be a little later. I'll have to look at the calendar, but those will
Sure.
be coming too. If you don't know me, again, I'm Dr. Ellie, and I'm at Middle Path Integrative Pediatrics on Hendersonville Road in Asheville. If you live in and around the area, please join the practice. Brandi, thank you so
Oh,
much
yeah.
for coming.
Thanks
I
for
really
having me.
appreciated it. Yeah, you were
Great.
so great. Wishing you guys well. Bye.